When it comes to men's health, what are the issues that most men are concerned about? Over years of research, a team tracked what men are really Googling about their health. Today, I'm revealing the top 5 searched men's health issues and reacting to them. Graph 1, most popular men's health searches, and we're looking at erectile dysfunction. Okay, wow. So in the last 10 years, we're looking at searches around ED. Now, there's an odd spike of the stuff in 2016, but actually it seems to be going up since 2018, which is really interesting, but probably is quite a good reflection on awareness around ED, or just the fact that more men are suddenly starting to think about their penises a bit more, which isn't a bad thing. I guess whether you're searching up ED because you've got a benign curiosity, or you've logged into your mate's computer on the work machine, you're trying to get him in trouble, or you actually have a genuine worry there's something wrong, it's a really good thing, because erectile dysfunction is associated with some major health problems like increased risk of cardiovascular disease, or increased risk of testosterone deficiency, or type 2 diabetes. So the fact that even people are willing to look up and go to the extent of typing in a pretty embarrassing thing on their computer is brilliant. So I think that's a good graph to have. Second graph shows prostate cancer. Now this one's a bit more unusual. It looks a bit more like my heart rate after I've had 3 or 4 coffees, because it is just all over the place. And oddly, the searches around prostate cancer don't really seem to increase an awful lot relatively in the last 10 years. That's quite sad, I think, because we all know that prostate cancer is the most common cancer in men, that if you live to 90, 99% of men are going to have cancerous cells in their prostate anyway. So we need to massively increase awareness around this. This is not related to the graph, but really annoyingly, we have no national screening for prostate cancer. We have cervical screening, we have breast cancer screening, we have bowel cancer screening, and even though almost every guy is going to have prostate cancer to some degree by the time they're old enough, we don't screen for it. The PSA, the blood screen that we do have, prostate-specific antigen, is not a bad test. It's not perfect, but it's the best thing we've got. And we now have MRI scanning to confirm whether it's a cancer or not. So very few people need to have a biopsy. We should be doing it more. One of the big things that stop men going to see their doctor is the fear of a rectal exam. And actually there's some nice studies looking at Afro-Caribbean men, and one of the main reasons these guys who are at higher risk of prostate cancer don't want to go see a doctor is because they've got fear of someone like me sticking their finger up their backside. I have to say, we just don't do that test all the time now, and it's not necessary if you're just going for screening. You only need to have that done if you have symptoms. So you could go to a doctor and just say, I just want to screen for prostate cancer. You don't have to have a rectal exam, but we massively need to increase awareness around this, because we're not going to decrease death rates. We're not going to decrease treatments that are severe and metastases and complications of the condition if we don't start screening for it. So I would massively like to see this graph go up as more people get more interest in prostate cancer. Next line, BPH, which I'm assuming stands for benign prostatic hyperplasia, which is a normal age-related growth of the prostate. Again, not many people really searching for BPH. I don't mind this quite so much because it's a relatively specialist medical term, but BPH is basically your prostate gland, and once you've had puberty, assuming every guy's gone through puberty, your prostate is gonna get bigger. And the prostate is a little walnut-sized organ that has your urethra, the tube you pee out of, that goes right through the middle of it. And as you get older, year on year, that walnut organ is going to get bigger and bigger and bigger, and you can't stop that. As it gets bigger, it's going to start squeezing the tube that you pee out of. And so by the time you're 40, most guys find they maybe get up once at night to pee, or maybe their stream isn't quite as good as it was. I mean, I remember, for example, when I was a kid, we used to play this game at primary school, obviously not as an adult because that'd be really weird, where you'd see how many steps back you could take from the urinal and still make it. I mean, our toilets in our school were probably an absolute disaster, but that's not the point. Key is you could take this game, and you could be like a metre and a half back, and you're still getting a massive hosepipe arc. And then of course that just drops, and you don't notice that it's dropping until it becomes a problem. So most blokes will only realise they've got BPH, that they've got this larger prostate, when suddenly they're waking up quite a lot at night to pee, or maybe they're not emptying properly and it's dribbling a bit afterwards and they're getting wetness in their pants, or maybe they're hesitating, they're trying to get to pee but they're getting stage fright effect and you just can't relax to pee properly, or maybe you need to pee again 5 minutes later. this isn't cancer. BPH is not cancer, but we should be thinking about screening for it better because it can cause complications like problems with your bladder, problems with your kidneys, and it can wreck your quality of life. And it's really easy to treat now. So I think, again, I'm not surprised people are looking for it, but I'd like to improve awareness around it. PE. PE either stands for physical education, which I wouldn't be surprised if people weren't looking for in a men's health topic, or it's standing for premature ejaculation, which probably makes much more sense. Premature ejaculation is defined as reaching climax before the desired time you wanted it to be, which sounds a bit vague and nebulous, but really we usually refer to this in terms of penetrative sex with a female partner because that's where most of the studies are done. But that isn't what real PE is. And real premature ejaculation just means that you can't last long enough to fulfill the sexual process that you want to with your partner. Now, in severe cases, we're talking like, seconds, and you may not even reach penetration because you just orgasm too quickly. And in these people, it can be really hard to treat. For most people, it tends to be actually, have I really got PE because I can't last for like an hour because I watched an adult film that said this guy was, built like a racehorse and he could effectively satisfy 30 women, and it's all like some sort of surreal, fancy-like environment. But we see younger guys coming in going, yeah, I can't do that, so I must have PE. And you're like, no, that's not real life. We would accept anything from 3 to 5 minutes as normal sexual activity, and that's absolutely fine because that is what normal sexual activity is for guys. PE is when you really cannot maintain a normal sexual relationship and it's either affecting you emotionally or your partner's having trouble with you, or you maybe can't even have true penetrative sex, which is going to have fertility issues because, of course, if you can't put two things together, you can't make a baby. So searches for PE are usually quite rare, and that's often because guys are really embarrassed about it. They may do it in the comfort of their own home. They may feel that if they can look for something and not feel embarrassed about it, they're okay, but actually it's still a really stigmatized topic. Probably in men's health, it's one of the most stigmatized area, worse than erectile dysfunction, worse than prostates, worse than testosterone, because it's something that guys really feel shameful about. Finally, low testosterone. Now, the relative search volume for low testosterone is depressingly low. So the fact that we're making this video is a good thing because it might get people to start thinking about this, because low testosterone affects millions of men in the UK, around 3 million or so are estimating. About 25% of all men are going to have low testosterone at some point in their lives. We don't know when that is, but that's still a massive number. And it's an incredibly devastating condition because if you have low testosterone, it increases your risk of things like cardiovascular disease or diabetes or osteoporosis or muscle breakdown or obesity and even possibly dementia. So we really should be thinking about actually, why aren't we screening for this and why aren't we looking for it more? And there's probably just two basic reasons that we're not searching for it. One, we don't teach it in medical school. Doctors don't know about it, so there's very little public awareness. And secondly, patients, the average public, don't know about it either. So if nobody knows to search for a term, nobody's looking it up, which means we're never going to get awareness about it and we're never going to increase treatment and better outcomes for men. It's clear these issues aren't going away, and that's exactly why I created the Man Alive podcast. Each week, I'll sit down with a celebrity or expert to bring men's health front and center. Many of our guests will even take a full blood test with their results revealed live on the show. So make sure you're subscribed on the YouTube or your favorite podcast app. You won't want to miss what we uncover.